So yeah, I'm based in Kathmandu, even though I work for the Institute for Global Health, and I've been in Kathmandu. I've been in Nepal for 20 years. I was also based in the Plains area for a while. And my presentation is about a public engagement piece of work that I did with a large team of people who I'll tell you about at the end. So Janakpur, I'm sure lots of you are familiar with Janakpur, but just to give you a bit of background in case you're not, it's one of the poorer places in Nepal. It has a low human development index, and it's on the plains it's in the plains area on the border with India, with Bihar. There's a large Hindu population, but also a lot of Muslims living there too. So it's a bit diverse. The culture and language there is Maithili. The language is Maithili, and one of the great things about the area is that it has a very strong local tradition of art. And I worked with the Janakpur Women's Development Centre on this project, among other people as well. But the main partners really were the artists. And the centre was started really to help women earn a livelihood from their art. Traditionally, women paint on the outside of their houses, and it's a female tradition. And then also the centre was a centre for social support, really, so that many of the women are really quite marginalised by caste or widowhood or poverty, etc. Many are illiterate. So the centre was also to bring women together for social support. So why are we focusing on diabetes? Well, diabetes is the third leading cause of mortality globally. So it's a huge public health problem. And most of the people with diabetes live in low and middle income countries. And there's a really high prevalence in Southeast Asia. And most of the people there have type 2 diabetes, which is largely preventable through lifestyle modification, policy change, etc. So you can prevent diabetes through physical activity, not drinking too much alcohol. So you can see the first picture there is about that. The second man has some cigarettes. So you can also, the cigarettes and tobacco consumption is another risk factor. Obesity is there also. If you reduce your sugar and salt consumption and you take more physical activity, you are unlikely to get diabetes. So another reason for focusing on diabetes was that the artists at the JWDC had lived experience of diabetes. It was in their families, some of the women themselves have it, and they were really interested in doing a project about diabetes. So we applied for funding and we got it. So we did this project together. So we aimed to really create a space for dialogue about diabetes, as well as increasing knowledge and understanding and motivation. We did it through a 4-step process of participatory action research. And then we did some planning and arting and designing. And then we did a traveling drama. And then the last one is the fun fair. Oops, oh, my computer decided not to change. Okay. So the first step was the participatory data collection. So the artists learned to be researchers. We did some brief training with them, and then they went out and spoke to their friends and family, and people with diabetes, people without diabetes, just so that we knew sort of what we should be covering in our public engagement event, and what the knowledge gaps were, what people wanted to know about. And so they also designed a pictorial consent form, because we wanted to record the interviews, because the artists, many of them are illiterate, so it was difficult for them to remember what people said. So we developed a pictorial consent form, and this picture here in the middle is the sort of do no harm picture. So I'm not going to talk a lot about this, but it was incredibly useful. We learned a lot from those peer interviews. we found that there was a lot of stigma around diabetes. Lots of people thought it was a communicable disease, and that caused stress and anxiety. Another big finding was that people felt you could only manage diabetes through abstinence. So you had to give up rice, you had to give up sweet things, whereas actually you don't need to give them up, you just need to control your consumption. So that second quote is from the adolescent girls as well. You cannot eat tasty foods. And then a huge issue was the cost of care and the guilt associated with that, because people felt that they didn't want to burden their families with the financial burden of taking medicine and going to Kathmandu, etc., for care. That second quote is from a man who had diabetes. So we really realized that there's not much we can do about the cost of care, for example. But if we focused on prevention and also developing empathy and just space for conversations about diabetes, that was really something which we wanted to do. So we did that by, first of all, developing our own capacity. So my capacity had been developed by learning about the sort of the local interpretations of diabetes. And the women wanted to learn more about how to prevent and control diabetes and what it was. And so we brought a health worker in who spoke to the women. That's the top picture. And then we did a participatory quiz with the women where we had a lot of discussion to develop their knowledge. We made games, so you can see that she's throwing a healthy food into a hungry person there. That was a practice for our Mela. Did lots of art, big cigarette packet being made there. We also interacted with students who were going to help us with the Mela, because we thought that lots of people come to it. The fun fair is a Mela, sorry, I'm using those terms interactively. We did some consultation with an advisory committee to make sure what we were doing was sort of inclusive and acceptable. We had someone from a gym come and give the women training on how to do dumbbell exercises with their papier-mâché dumbbells. We did some food making as well, so lots of different activities. And this is about the drama. We took it around lots of villages. And you can see that we used huge costumes and no words to provoke debate. So you can see a bit more of that in the film. So at the Mela, we had lots of activities. We had those games. So this one, the girl is she's throwing a cauliflower at a bottle of whiskey, I think that is. And we did free blood glucose testing for people. We did Zumba and drama and music and quiz and lots of things. And this man is listening to a photo story where we'd had a photo and then you could put headphones on to listen to the story. So I'll tell you about our evaluation. It's a bit back to front now, but I'll tell you about our evaluation just before you watch the film. We did kind of mixed methods observation. Again, participatory methods. We got the artists to make a visual timeline to reflect on the lessons learned. And they did peer interviews again. So we did this is a few numbers, 21 dramas, and there were 40 to 100 people per drama. So it reached a lot of people there. Around 4,000 people came to the Mela. There were 800 blood glucose tests done. We actually ran out, probably could have done more. And we found that the interaction at the smaller events with the drama was kind of more productive almost, we felt like. So we think we want to do a bit more of that and a bit less of a sort of big activity. And the gender nature of the space that we ran the Mela in, it was generally a place where men came to play cricket and hang out with their friends. And so although we did get women there, we think that was because there was a religious event happening at the same time. So that was really beneficial for us. So these, we obviously disseminated in lots of different ways. You can find out about those at the website. And these are all the fabulous partners that we worked with. So I'll stop talking there and you can possibly show the film, Anna. Okay.
All right, just give me a second to bring up the film. All right, so here we go. And I'm also going to put the link to this film in the chat. So in case any of you can't hear it or can't see it and just your connection doesn't work with this film, then you can mute us and go to the film on your own connections. So first I'll start it here.
एक गांव में चीनी रोग के पकड़ लेने से 40-50 आदमी के सैकड़ा में बहुत लोग के चीनी रोग से कते आदमी खत्म हो गए हार्ट से उनका कथी भाई छी कथी पता नहीं देखा नहीं रहल छै चीनी रोग कत छै तो चीनी रोग लक कहे खत्म हो गए
चीनी रोग के बारे में तो पहले हम सब ओते जानकारियो नहीं छै मतलब गांव घर में भेदभाव के नजर से देखते रही ये पेटी होता है एना नहीं कर ओना नहीं कर इन आबे एला से बहुत समझ में एलिए से ई नहीं होई मतलब सर्वा रोग नहीं होई छै से सब बहुत निक लागल सब बीच का
बहुत लोग अखन घर में छुपा छुपा के चीनी रोग रखने छी आ कते के जानकारिये नहीं छै कते के जानकारियो छै त अहाँ के सब चीज खान पान में खाइते रह जाय छी त तै दुआरे जे उसमें तो कहलखिन जे ई सब जे बनेबे आ गांव घर में प्रचार करबे नहीं तो ई सब के बढ़िया हेते कि बहुत लोग जानकारी होते तो जानकारी भेला पर इहे चीज सब यूज करते खाना खा के लेल में तै दुआरे हम सब बनलिए मेहनत के लिए
त्यही भाषा त विभिन्न हुन सक्छ तर चित्रले भनेको एउटै भाषा बोल्छ हैन मित्र चित्रकलाको प्रयोगबाट चाहिँ डायबिटिज सम्बन्धी जनचेतना जगाउने प्रयास चाहिँ गरिरहेको छौं ब्रिन्जल घान्टा यो सँगसँगै छ यहाँ अहिले तयार हुँदैछ यो चाहिँ हामीसँग क्याप्सिकम प्रोजेक्टको लागि मुख्य मान्छे चाहिँ हाम्रो जनकपुर नारी विकास केन्द्रका महिलाहरू नै हुन् रिसर्चको लागि डाटा ल्याउने काम पनि उहाँहरूले नै गरिरहनु भएको छ र त्यसको लागि चाहिँ हामीले डायबिटिजको बारेमा चाहिँ सानो ओरिएन्टेसन दिने काम गर्यौं रिसर्चको लागि डाटा ल्याउने काम पनि उहाँहरूले नै गरिरहनु भएको छ र साथै मेलाको लागि तयारी विभिन्न प्रकारको तयारी गर्ने काम पनि उहाँहरूले नै गरिरहनु भएको छ
सबके ओ कने कने सचियो चीनी रोग कोना हटाबै है सबके ओ कने कने सचियो चीनी रोग कोना हटाबै है कोना हटाबै है कोना हटाबै
जिए के लिए हमके बहुते चीज करे पड़तो कोदारी चलबे चले पहले अब लोग घर में बैठ के खाए छे तो बैठ के नहीं खाओ परिवारों के कहियो खेती बाड़ी करे के लागी पहले लोग किस्सा कुटिया करे छे तो किस्सा कुटिया नहीं करे छे तो घर वाली के कहू काम करे के लागी घर में बैठबे तो चीज लोग पकड़ ले छे कोनो बीमारी भ जाय छे आ जते चल फिर करते तते किछ नहीं तो प्रोजेक्ट द्वारा हमरा सब कहल के गांव गांव नाटक करे के लागी सिखावे के लागी ओना तै से पहले हम सब किछ नहीं बुझे चलिए नाटक द्वारा से हम सब बहुत चीज सीखलिए बहुत चीज बुझलिए हमरा बुझाइए अनुभव
सब लोग बुझ लेते सुन लेते या नीक होती सब गोरा
तो चीनी रोग के मिला के लागी तैयारी कर रहल छी जते चीनी रोग में अहाँ के खराब सामान सब खाए छे बहुत एहन से सब हम सब तैयारी के लिए सिलाई के सामान सब फेंटा बना लेली तो आइसक्रीम बनौली तो सिरिंज बनौली अहाँ के सिगरेट बनौली ई सबटा बहुत रंग के डिजाइन देथिन लेकिन हम सब पूरा के सीख कर बुझी बहुत मेहनत केली सब आदमी तो बनौली ओ सब एहिमे तो शुरू में तो बहुत तकलीफ भेल जे केना के बनेबै हम सब केना की करबै जे बजथिन जे ऐसा एक साल गाड़ी बजथिन जे एना चीनी पर जे रहते तो हम सब कहिए केना के बनते कोनो सामान तोरा सबके बहुत होश आयल के जे हम सब बना लेबै हम सब कऽ लेबै तऽ तहिना तऽ अखन हम सब सबटा बना लेलियै तऽ आब नहि दुख के महसूस नहीं अबैया पहिने तऽ आयल आब नहीं अबैया
पहिले से कथु नहीं बुझाइ छलै जेना किछो नहीं बुझै छलियै जेना पहिने खाली मिथिला पेंटिंग मात्रे छलियै मिथिला पेंटिंग के ज्ञान मात्रे छलै अब प्लाई बोर्ड में केना बनतै चार ओहि में केना भरतै ओहि में प्रिंटिंग केना होतै फिर तरकारी में से हम बना के छाँट के फिर कपड़ा में केना लऽ जेबै से पहिने हमरा ज्ञान नहीं छल एहि चीनी प्रोजेक्ट जे अलियै तहिया से बहुते हम सब ज्ञान भेलै पहिने जे हम सब मिथिला राज में मिथिला धनुषा भगवान के मिथिला जानकी जी के राज है तो अ राज के नियम है कि घूंघटा तान नहीं उगार के लागे तो अ राज्य के वह नियम है तो उ घूंघटा तनलिए तो रोग भ गेले तरे तरे आ अखनी जे घूंघटा वही द्वारे हटा के गामे गामे नाटक के लिए जे ई चीज सब व्यक्ति के नहीं हो तै के लागे हम सब लाज नहीं क ई मेहनत के लिए एकदम बुद्धि खुल गेल दिमाग खुल गेल कि आब हम कहुओ अकेला जिंदगी जी सकै छी आ केहनो लोक ल हम बाज सकै छियै ये कार्यक्रम के बारे में चाहे दोसरो बात चाहे तेसरो बात पहले हमरा सबके एते बुद्धि नहीं चले एहि रास्ता से चलू ई बीमारी नहीं होइत एहि रास्ता से एना चलू एहि गड्ढा में नहीं गिरब से सब कह के हम सब कोई सकै छी आब हमरा बहुते चिंता भ गेलै हमरा सामने ऐसे पहिने अपन काम कर छली पेंटिंग हम अपन काम कर छलिए तो कोनो ओतेक लगाव नहीं रहले ई केहन काम है तो सबके सब ओझरा गेले जेना भ गेले सब कोई सब मिल गेलिए या जेना बहुते मेल भ गेले नहीं पूछ के हमरा बनी वाला ना है अय पेंटिंग करे छै त हम ओता स्क्रीन में निकाल छी स्क्रीन में निकाल के त हम पेंटिंग प्रिंटिंग करे छिए त सरो निकाल के दै छथिन दोसरो शाखा के काम लगे छै पहिले से अपनी जेना मेल मिलाप बेसी बढ़ गेलिए 3 महीना से जना बेसी एक दोसर से लगाव बेसी भ
हम सब सीखलिए सीख कर तो आब गुनो भेल भीतर तो वो तो आब चल जेथिन आब तो 2 दिन मात्रे बाकी छै आब 2 दिन के बाद ई बीत जेती तकर बाद आब हमरा सबके जे ई एते सीखलिए जे ताहि दुआरे आ दूसरो आदमी के कह सकै छी कतौ एकदम बढ़िया से रह के कतौ अगाड़ी रह सकै छी पछाड़ी नहीं आवे आब ई प्रोजेक्ट में एते हमरा सबके शक्ति आयल चीनी रोग के बारे में
Thanks for that. Did you want to give follow-up comments about the film, Joanna?
No, I mean, I think that, yeah, I think it brings the artist's voice into into the research and the project. So I think it's good to leave it there.
Well, thank you, Joanna, for your presentation and those great visuals about a really important health topic, but love how you use the art to engage the community and also to share with us here and as a record of the creative endeavor. So thank you so much. And has Rita joined us yet? No. So you're welcome to add anything, but if you want to just leave it there, we'll move on to the next panelist. And that is Sameen Mohsin. And nice to meet you, Sameen. And you're joined by Samia Altaf. And you're with, who's in public health, a public health expert. And you are joined with Kabir Altaf, who's a scriptwriter. And also Areeba Haseeb, artist at the University of Birmingham in UK, and also based in Pakistan, is that correct? So I'll turn it over to you as a group to handle how you're going to manage your time. And I think we have lots of time, so no rush. We don't want to rush you in any way, but the topic, the panelist presentation is titled Improving Public Health Education Among Young People Through Visual Storytelling. So I look forward to your presentation. I'll let you manage it. Like I said, we have time, so we're not going to rush anybody and leave it open for question and answer at the end. Okay, I'll mute myself now.
So I'm just going to share slides and take it from there. Hopefully everybody can see that. So I'm the one based at the University of Birmingham, and that's a fairly recent association, which is part of the reason why this is still a in-progress project, and for a few other reasons, but that's one of the reasons. Everybody else on the team is based in Pakistan, and we've been working on immunization, Samia and myself, since 2018-19 in Pakistan, and Kabir and Areeba have joined us for this little project that we had where we wanted to do something more visual in terms of communicating the importance of immunization, especially for young people. And so what we're going to do through this presentation is give you a little bit of background on our research, and that's how Samia will start us off, and situate it a little bit in terms of, very briefly, in terms of the literature, in terms of the state of things in Pakistan. And then we'll have Kabir and Areeba talk a little bit about the art and the plot line and why we made the choices that we did. And then I will wrap up by telling you a little bit about why this project has dragged on for as long as it has, some of the constraints on our side, some of the constraints on the side of funders and the government, and so on and so forth, and where we are at in terms of the project now. So I'm going to start off by handing over to Samia Altaf, who's our the team public health expert, and she will tell us a little bit about the background. Samia, over to you.
Thank you. Thank you very much, Sameen, and hello to everyone in this wonderful conference. And thank you very much for giving us this opportunity to talk about our work, which we feel very, very passionate about. You know, all of us know that one of the major tenets of larger public health programs is the health protection of the population at the individual level as well as the population level. And for health protection, especially in children, vaccination is a major tool in our toolbox, in the toolbox of public health specialists, and also in the toolbox of society and policymakers as general. So as Sameen said, she and I have been involved specifically in looking at vaccination related issues regarding polio in rural Pakistan for many years, since 2019, doing specific research in one of the districts outside of Lahore. I've been a public health doctor, a specialist for almost all my career, and have been writing about vaccinations and lack of vaccinations in developing countries, especially in Pakistan. So what our research showed us specifically, as has the research of other people who have been involved in this field, is that one of the major there's a lot of vaccine hesitancy in contributing to low vaccination rates in different countries. We also found that in our research that there was a lot of vaccine hesitancy, and parents who make decisions about getting their children vaccinated are reluctant to do that because they really don't have enough information about why do they need vaccination, or information about where to get it, information about the schedule and timing. So we, while we were grappling with that and we were writing about this and we were thinking what we should do and how should we bring it to the notice of the health department, of course, we did this research when Sameen was a professor at LUMS University, Lahore University of Management Sciences in Lahore, and I was a research associate at the university. So we wanted to do that, to bring that information from our research to the knowledge and maybe to some integrated policy to the Department of Health. While we were grappling with that, COVID happened. So and once the vaccinations for COVID started to come about, there was an understanding that the same issues will apply to COVID vaccination as they had done to the other vaccinations in Pakistan. So we decided that we will use our knowledge that we have gained specifically about the polio vaccination to COVID vaccination. So this project basically is to overcome vaccine hesitancy, and instead of targeting to parents or to mothers, which is traditionally done, we thought we would use the target as the school children, because they are also in 1 or 2 years, they will grow up and would need vaccinations and against other diseases, and also they would be able to talk about vaccination amongst themselves. So that is the overall, the general overview of the project, that the target audience is school children, and the content of the vaccination is knowledge and conveying knowledge, information to school children, and what should be our communication strategy. So the communication strategy was this booklet that we had produced. And I would stop here and let my colleagues Kabir and Areeba talk about this process which they followed to produce this booklet. So thank you very much. Over to you, Kabir.
Okay. So we should move on to the next slides then.
Kabir, do you want me to give a little bit of background, or should we talk plot first?
Yeah, I guess we can go on to the plot part. Okay. So so our project, we decided to go to, I guess the first thing I would say is why we chose the central character that gets vaccinated to be this cat, who we named Billu, because there was a lot.
I think, excuse me, I think it'll probably be important to talk about the story, the plot.
That's right. So because traditionally, one choice that we could have made and one choice that most people make is to say that, okay, it'll be about getting a baby vaccinated or getting a small child vaccinated. So why did we not have a story where the family is getting one of their own children vaccinated? So one of the reasons was because I think we thought that's very traditional. It's kind of the ordinary thing. So to make it more interesting, we thought, okay, what if it's a pet that is being vaccinated and not, a child? And also, it was because children are generally not responsible for getting their younger siblings vaccinated or for getting themselves vaccinated. That is a decision that, of course, their parents make. And so, but children are responsible for their pets. If in a family that has a pet, especially if it's the child's pet, I think children are much more involved in the day-to-day decisions about that pet and its health. So we thought that in order to make it more interesting for the children and in order to target it to them, the story is about getting a cat vaccinated as opposed to getting a child vaccinated. And of course, there was some discussion about this, which I guess Areeba will go into later, but a little bit, it was because when we sent it to the government and to the funders, they said, well, you know, if your initial target is a lower middle class family in Pakistan, lower middle class families don't really have animals at home, at least not these cats or dogs. You know, I mean, if they're a rural family, they will have cats and chickens and things, but those are agricultural animals associated with, you know, some utilitarian purpose, not really pets. It's more sort of your middle class, upper middle class Pakistanis that have, you know, pet animals. And also, you know, our story, we show the cat being taken to the vet and things like that. And also, again, that requires a certain amount of, a certain class background to be able to go to the vet and things like that. So that was the main sort of decision, main choice that we made. And the booklet basically is just, the story is basically that, you know, one of the children from the family comes home and says, you know, today in school, we were talking about vaccination and am I vaccinated? And then the mother says, you know, yes, you are. And she explains what the schedule is for child vaccinations in Pakistan. And then he asks that, what about Billu? Because Billu is part of our family also. So shouldn't he be vaccinated? And then the mother says that, you know, well, that's a very good thought and we should go take the cat to the vet. And so the story then basically follows that. I think that's all I have to say about that. So if Areeba wants to take over.
Hello, everybody. My name is Areeba. I am the illustrator for this project. So I'd like to talk a bit about the visual process as well as the character design of the cat. So first of all, just talking about what Kabir said, we did have this problem that, or the government sponsors did say that lower middle class people don't have cats. However, we have, as locals, we have seen many lower middle class people who have pets and they treat them very well. So I don't think it has anything to do with money, but I think it's just an opinionated fact. Other than that, the comedic approach. So basically, we have to talk about Billu's character, which is very funny. So we didn't want to just make a very cute little, you know, cat and just something that people would be like, you know, it's just a cat, it doesn't have a character. So we wanted to make him as funny as we could. And you can see he just looks like a man here. He has a little mustache, he has a beard, and he looks like a very typical Pakistani man. And that's the character we were going for. So we wanted to show that even though he's a cat and it's the child's responsibility, this cat has the personality of an adult who is set in his ways and he just does not want to get vaccinated. And so his expression was so important because we had to show how he hated being vaccinated to someone who's like, yeah, I like this idea. I think that was very important for him. Can we move on to the next slide? So as you can see, here's the family, and you can see right off, you know, like the contrast between their characters. The family is like neutral, like they look like any other Pakistani family. We didn't want to add much to their characters just because we wanted the kids to just look at Billu's expression throughout the whole book rather than focusing on the other characters. And that's what we wanted to do with them. So I think that's it for the character design. For the booklet design, it was a very simple booklet. It was a zine actually, which is interactive. So we wanted the kids to just fold up the zine and, you know, have fun with it. And the color of the, like the color that's most prominent in this booklet is blue, because we wanted to make that connection that medical brochures are blue as well as many medical fields tend to use a lot of blue. So we wanted the kids to think that even though this is a children's story, this is still something that's related to the medical field. And I think that was all the visual process that I could add on. Kabir, do you want to add something?
No, I think that's pretty much it. I mean, you said the kids are neutral. I mean, I think that is true. The family is neutral, but you also did manage to give each of them sort of their own look and their own character. I mean, you can see in the picture that the mother, you know, she looks like a typical kind of conservative mother, I guess, because she has her head covered, and that was another issue which Sameen will go into later, because
definitely.
this is an issue. As also, I think in the last presentation we saw the lady was discussing ghungat and veiling. So that is not necessarily only an Islamic thing, but it's a part of the larger South Asian culture. So there was some discussion about whether the mother and the daughter should have hijab on their head. And I think we agreed that, okay, the mother, she's an adult, so she's going to be wearing her dupatta on her head. The girl, since she's pre-adolescent, I think we decided that she will not have her head covered. But yeah, I was just going to say that every character has their own sort of appearance, not just Billu, although of course the focus is on Billu because he's the central character. Yeah, I think
definitely.
Sameen, can I just jump in for a minute
Sure.
over here? Yes, I think it is remarkably done visual and script, because we were very conscious of this fact that in the writing of the script, we should have the content and the words that come out of the mouths of these children, which are very consistent with the cultural practices and how these children interact with each other, so that there is it doesn't seem alien when these children are reading that. So I think that is also very important. We debated over those things, and now we do feel that Kabir and I actually field tested this script and a little bit before it became final with some of the children and parents in a more or less a similar neighborhood. And it was very well received. The kids responded to it, children responded to it, and their parents also did. But I think our biggest challenge is what Sameen is going to talk about, that, how do we get this to be incorporated into the government's public health efforts that they are conducting.
And I think on that note, one other issue which is important is that, right now this booklet is in English, because that was for us, it was easier to write it in English than in Urdu or in Punjabi or anything. But the fact that it is in English necessarily limits the audience, because yes, there are English medium schools in Pakistan, there are many, but again, the class position, the kids that are going to English medium schools are generally middle class, upper middle class. And in terms of the reach that the target audience, kids that are from middle class, upper middle class families generally know about vaccination, or if they don't, their parents know about vaccination and they get them vaccinated. So the issue is much more for the mass of the country, which is maybe 90% of Pakistan's population is not middle class, upper middle class. So to reach them and to reach those school kids, it would actually be much more beneficial for this to be in the national language, which is Urdu, or because we are located in Lahore, we should have it actually translated into Punjabi, which is the provincial language. So, and also if we hope later to use it in other parts of Pakistan, then it would need to be translated into Sindhi or Pashto or Balochi. So those are all things that needs to be done. It's just important to highlight the fact that English is sort of an elite language in Pakistan. So right now, the reach of this booklet is sort of necessarily limited. That's all that was.
Yeah, I'd like to add something. When we first designed this, the first few illustrations that we created were actually intended for the lower population. But we were told by certain people that, this looks like there are two lower class, and like going back into the whole topic that lower class people don't keep cats. So initially, we were going for it to be in Urdu, as well as we had rickshaws instead of cars, and we had the kids were wearing different clothing as well. So I think we did have trouble with that as well during the process.
Okay, I'm gonna skip back a bit and give you a bit of background, just so you know why we ran into trouble with different people in terms of what the booklet should look like. Obviously, there's lots of explanations for why vaccine hesitancy happens. It's bureaucracy, it's poor infrastructure, there's a punitive and absent state which suddenly becomes interested in vaccinating you. There's also mother's education or parental knowledge, and all of these, there's quite substantial literature on all of them, and there's some literature on Pakistan for each of these. But we found that household decision-making tends to be really complex, particularly in patriarchal societies. So the focus on mother's education is important, but it doesn't mean necessarily that decision-making is being done by the mother in contexts like Pakistan. And so one of the approaches that I bring to the table in this project is sort of thinking about the power dynamics that are at play within families in terms of the decision-making that goes into immunizing or not immunizing your child. So what we started talking about in terms of messaging and information was looking at sort of framing, considering the role that informational interventions play in public health. And there is recent evidence that they are important, particularly educational interventions, and they do improve knowledge of not just immunization, but also other kinds of public health issues, hand washing, especially with COVID. And there have been positive results in low and middle income countries. And in fact, the WHO recommends bundling school-based interventions, particularly. So for example, HPV with deworming or nutritional information should be, according to them, bundled together and reduce delivery costs. And these have been shown to be successful. So we felt that this was an important detail, particularly with regard to Pakistan's public health program. In South Asia, because community bonds are strong, you would think that community health would be a very significant area, and in some countries it is. In Pakistan, yes and no. So there are some activities that do take place at the community level, like lady health workers, which have played a crucial role in terms of public health. But on a policy level or on a government level, community health does not seem to be a priority. And in fact, reviews of policy in Pakistan show that largely the focus of governments has been on standalone reforms, so contracts and staffing and health insurance and things like that, which seem really great when you start them out and when you publicize them, but they don't deal with the preventative aspect of health. And so a lot of immunization advice, in particular in Pakistan, is presented sort of in isolation, and a lot of it comes from drawing on Western influence in terms of this field and donor advice, particularly on things like polio. So just to show you a contrast, this is the imaging that has come out of the expanded program for immunization in Pakistan and UNICEF. And the focus is very individual. The focus is very much on the family unit. It's not on a community. It's not on any kind of collective. It's the parental responsibility that is the emphasis. You should vaccinate your child for your health, for your family. And even, there's no emphasis on an extended family. It's very much on a nuclear family. And I found that very interesting. In terms of the setting in which this is taking place. School-based health education in Pakistan is very intermittent, very sporadic, very, in fact, random, I guess is the word. There was a program in 2005, another in 2006. They lasted a few years, but the emphasis remained curative. And the reach has been fairly limited. So it's actually something that the government has not focused on in any detail. And where they have, unsurprisingly, perhaps the biggest roadblock ends up being bureaucratic issues, like who is going to staff this program, who is going to run it, who is going to plan it, and so on and so forth. And it ultimately stagnates whenever it has been attempted. Because the education system is very reliant on not just curative work, but also monitoring and rote learning. It doesn't really think about creative processes, certainly doesn't think about art as something to do with science or to do with medicine or public health. So this is very much a gap in Pakistan's education system. So we decided that the booklet would sort of fill these gaps, and Areeba and Kabir have talked about that a little bit. This project, because we were drawing on earlier work on immunization, so we did go ahead and start working on it. Our funders were local funders, so this is not an international organization that funded this work, either our immunization work or this project. It was the university I was working at, the Lahore University of Management Sciences, and another organization. But when we made the booklet, we ran into two problems. The first was that one of the funders said that, well, we could potentially get blowback from this booklet, because immunization is a very touchy issue in Pakistan. For those of you who may or may not know, there's a lot of association with American imperialism because of Osama bin Laden. There's a whole story there, which we can talk about later, but with not just American imperialism, but also with state imposition, that this is something that the state is trying to use to control the population, and that there is an attempt to control the Muslim population in particular by making them infertile and so on. So there are consequences to talking about vaccinations in Pakistan. And so the funder was very, very cautious and said that, well, I want you to go to the government and approve, who has to approve the entire booklet, the storyline, the pictures, everything, and get a letter from them saying so. Now, in Pakistan, that is not an easy task because the government obviously will bring its own agenda to the table, which they did. So the booklet changed substantially in our conversations with the government. So the plot line, the imagery in terms of the class, and also in terms of inserting a lot of government sort of images into the visuals. So images of, vaccination cards, authorized vaccination cards, things like that. Interestingly, the class issue and the pet ownership issue was not something that was brought up by the government representative. It was something that was brought up by a representative of UNICEF who happened to be sitting in the room at the time. And I found that very interesting, that the donor was far more conservative than the government person was in terms of, the setting and the storyline and things like that. The government guy was like, oh yeah, it's fine to have a pet, and people will understand, and people like cats, it's fine. It was the guy from UNICEF who said, oh, no, this is the class is wrong, and look is wrong, and this is wrong. So I found that dynamic very, very interesting from my perspective. But ultimately, we had 3 or 4 rounds of sending this back and forth between the government representative and the government of Punjab and us, and finalizing something. So we finally have the letter now. The other problem we ran into was that the government around this time, which is about the summer of last year, introduced a new single national curriculum, which is largely regressive, is my opinion. What that meant was that because it imposed a new system on schools, a new curriculum on schools, it threw everyone basically for a 6, and everyone was scrambling to adjust to this new curriculum. And it left absolutely no room for any other materials to be introduced either in private schools or in public schools. So automatically this project kind of ground to a halt because we couldn't introduce something while this new curriculum was being introduced. So the government has recently changed. We don't yet know if this curriculum will continue. And it's given us a bit of time, obviously, to think through what we might do. One of the things that we had thought about was that if we can't introduce this as a booklet into schools, one is to just release it like on the internet and let people use it for free. And to do sort of performance-based presentations at schools, which would be a little less sort of in your face as far as the government was concerned and the new curriculum was concerned. But these are things that, we're still talking about. And because of my move to Birmingham, obviously I'm no longer based in Pakistan. So we've had to think a bit creatively about how to take this forward. And I very much learned from Joanna's presentation about how one could potentially do that. So I'm going to stop here and happy to take questions. Thank you very much.